Hello, I'm Wendy Terrell from Platform Q Health Education, and I'm joined today by Dr. Seth Baum from the Charles E. Schmidt College of Medicine. We're meant to present this poster at the 2020 ADA Scientific Sessions in Chicago, but due to COVID-19 cancellations and the rescheduling of ADA as a virtual conference, we're very happy to present this poster to you today in this video format. So in essence, this poster highlights results of an educational evaluation of the impact of live online CME on HCP knowledge, competence, and behavior. So it is an educational outcomes evaluation poster. The program itself was a partnership with the American Society for Preventive Cardiology, and the accredited provider was the Einstein College of Medicine. The content of the CME program mainly targeted cardiologist learners regarding recent cardiovascular outcomes trials that assess the impact of anti-diabetes medications on the treatment and management of cardiac conditions. Importantly, we'd like to acknowledge the generous support of the following companies for providing unrestricted educational grants to support the initiative: AstraZeneca, Boehringer Ingelheim Pharmaceuticals, Lilly, and Novo Nordisk. Here you can see the disclosures of all of the poster authors.
As far as I'm concerned, what these data show is that you actually should be perhaps more aggressive in younger patients.
To limit the burden of disease.
Because you got to look at lifetime
the burden
risk.
of time, right, exactly.
Right.
And interestingly, the same thing applies to LDL.
They don't improve insulin sensitivity, but it's a different reduction. They do reduce very nicely glucose, ranging from 0.7 to 1.2, now 1.5, with a once-a-week medication. The weight change is very impressive, running between 3 to 4% weight loss. Blood pressure reduction is also very nice, like the SGLT2s. What the ACE has been saying in 2019 is that if there is a person with an established cardiovascular disease who is not on an SGLT2 inhibitor or GLP-1 RA, they have to be on one.
There's been an enormous progress as well. I would say from my standpoint as a cardiologist, enormous step forward to say that our way of thinking about diabetes management really now has to do with reducing complications, not just through glycemia, but through other interventions that may have an effect on hemoglobin A1C and they may lower glucose, but the cardiovascular effectiveness of those interventions is likely independent of hemoglobin A1C. If there is a way to get this patient on one of the agents with proven cardiovascular benefit, anti-diabetic agents, there's clearly an opportunity to do that. And again, there are pluses and minuses which particular agent you will go after.
So how you do it, which one you do, those are the details, but the dominant point is patient needs to be on one of those
Correct.
medicines.
And I think that's what the ACE guideline that I said before, they have to be on that.
So what you've just been watching were some excerpts from the two programs that we conducted. The first was on cardiovascular outcomes trials of anti-diabetic medications, rationale and data in studies of SGLT2 inhibitors and GLP-1 receptor agonists. And the second, diabetes from the perspective of the cardiologist, optimizing cardiac and glycemic outcomes. So you see that these were 2 one-hour-long CME video activities that were very interesting insofar as they had interactive elements such as live Q&A and live polling and pretty engaging panel discussions, I think. So the learners were encouraged to submit questions before and during the live programs. I was joined at the time by Drs. Handelsman and Kosiborod, both of whom we mentioned the American Society for Preventive Cardiology, both of whom were on the board of the American Society for Preventive Cardiology, and I am the immediate past president of the society. So I think I should mention that because this was done in collaboration with the society. The learning objectives were important because they are meant to address the very substantial need that we currently have for engaging cardiologists and primary care providers in the management of diabetic patients who have established cardiovascular disease. And the reason this is so important is that we now have therapeutics that can benefit these patients from a cardiovascular disease standpoint, not just from a diabetes standpoint. And we have guidelines to support the use of these agents when appropriate. So we discussed connections between the etiology and pathophysiology of various components of the cardiometabolic syndrome in these patients, describe the rationale for using a variety of medications, discuss the medications that have demonstrated cardiovascular benefits in patients with type 2 diabetes and established cardiovascular disease, and perhaps even most importantly, demonstrate where cardiologists should really take the lead and actually prescribe some of these medicines, which is something that cardiologists have been a little bit reluctant to do. The Albert Einstein College of Medicine and Montefiore Medical Center were the accreditors of this CME program.
Great. Here you can see our methodology for the educational evaluation of the impact of the program. So we had a pre-test that was administered online immediately prior to the start of the program. There was an immediate post-test, and then after a 2-month waiting period, there was a 2-month follow-up post-test as well. And it was at that 2-month point that we were able to ask more behaviorally focused questions, because learners would have had the opportunity to see patients in their practice. Now I'm going to share some engagement statistics. So there were 1,389 total learners, and those are unique learners for the CME program. 719 credits were issued. There were 19 total questions asked, 195 total slide downloads, and quite a bit part of a large participation in the in-session polling, 950 total responses to the in-session polling.
So you can see that we had a lot of engagement from the learners, and that's very telling. We had, number one, we had a lot of learners, but we also had a good number of people who were involved and who asked questions during the presentations. What we also had were some really interesting comments from the learners, and some of them I think deserve being highlighted. Some of them I think deserve being highlighted, such as a definite lowering of cardiovascular disease events and better glycemic control among patients, or positive and reduced the rate of hospitalization for heart failure. Now remember, this is just 2 months out from the program. Lowered hemoglobin A1C and reduced the risk of cardiac problems and weight loss with SGLT2 inhibitors. So the learners were very positive about patient outcomes and patient experiences at that 2-month mark. When learners reported how the programs affected the clinical practice, they were equally effusive and stated greater use of SGLT2 inhibitors in clinical practice and better and earlier utilization of both SGLT2 inhibitors and GLP-1 receptor agonists, more aggressive intervention in type 2 diabetes and prediabetes management by prescribing SGLT2 inhibitors and GLP-1 receptor agonists. So overall, you can see that the programs had a positive impact that was very strongly felt by the learners.
Great. So there were 8 CME test questions that were asked at 3 points in time, pre-test, immediate post-test, and at that 2-month follow-up post-test. And here we have the increases pre to post on the left, and then the second circle on the right is the baseline to 2-month follow-up average increases. We've listed the effect sizes as well for those 2 comparisons. So the pre to post effect size was quite large with a Cohen's d of over 1.0. And on the right side of the screen, at the 2-month follow-up, learners were asked to identify areas where they saw the most impact, and the top 3 areas of impact are listed here. They have to deal with confidence, in the topic areas, assessment, and incorporation of agents.
So really, in conclusion, we could see that this online CME program was very effective. It influenced cardiologists and primary care providers, specifically in the realm of managing diabetic patients with established cardiovascular disease, and using therapeutics that have proven risk reduction characteristics. It's cardiovascular risk reduction characteristics. So the learners clearly got something out of this. They wrote in numerous responses stating how at 2 months the programs had positively impacted their patients and their clinical practice. The next step really is, where do we go from here from an educational standpoint? Well, educators have looked at the results of these two programs and determined that best areas to move forward would include things like how to manage diabetic patients with prior infarct, or review of clinical practice guidelines, specifically with respect to the SGLT2 inhibitors and GLP-1 receptor agonists in the setting of diabetes and established cardiovascular disease. So I think moving forward, we'll be able to do a lot more in this area. I think this was very effective, and I was very proud to be a part. And I know Drs. Kosiborod and Handelsman were very happy to be a part of this as well. And I'm very grateful for all of the help we had in putting this together and presenting it to so many clinicians. I want to thank you, and I want to thank everyone who has participated in this program.